When I was in medical school, it really was a decision about trying to pick a specialty that you can help people. You can actually truly change their quality of life. When patients generally come in to see you, it's a calendar day for them, meaning that they circle on their calendar. It's a big event. They've told their grandparents about it. They've told their kids about it. They're going to change their lives. And so to see people go from inactivity to an active lifestyle is extremely rewarding, and that's something that will get you out of bed every day.
In the past 5 years, how has the medical industry and technology improved, as well as your abilities?
Technology is exploding. So the onset of robotic surgery, the onset of minimally invasive surgery, the chance to now move patients to outpatient surgery for total joint replacements. When I first started practicing in the 1990s, if you had your knee replaced, you stayed in the hospital for about a week, and you usually went to rehab for about another 2 weeks. Now, patients usually stay in the hospital overnight or possibly go home the same day.
As your medical career moves forward, how do you continue to improve and stay on the cutting edge?
Basically, there's a ebb and flow to your career. So in the beginning, you have a lot of knowledge without a lot of technical capabilities, and then you sort of hit your sweet spot, which is in your 40s and 50s, where your knowledge and your technical capabilities combined. So I'm sort of at that area right now. I do actually a lot of teaching, so I actually am giving back to the younger surgeons, and I teach a lot of the procedures that I do. So it's, like I said, it's an extremely exciting time.
What led to your decision to join the First Choice team?
First Choice is an excellent situation. It's a combination of a sports doctor and Dr. Lombardo, shoulder and elbow and hand and Dr. Harrison, myself with hip and knee replacements, and then we have a very tight affiliation with the back center with Dr. Hines and Dr. Data. So as far as coverage of the fields within orthopedics, it's excellent. One location is fantastic, and there's a lot of camaraderie amongst the different surgeons, which is rather rare in a practice of this size. And then the decision to stay in Brevard County was an easy one. My family loves it here in Brevard County. We moved here from Georgia. We really made a home here in Florida, and my kids have flourished.
Are there any technological advances on the horizon that you are particularly excited about?
Well, there are a couple of things. So on the knee replacement side, I'm extremely excited about the possibility of doing ACL sparing total knee replacement. So the advantage there is that we no longer have to sacrifice the ACL or sacrifice the PCL. We can actually maintain all the natural ligaments in the person's knee, which provides for a more normal feel to their knee. Then there's also the advancement of doing outpatient total joint surgery. So no longer do you have to stay in the hospital for a week or 2 weeks. You can actually have your surgery done, go home, and do your rehab at home. So the advancements will keep coming, and I'm very excited.
What big changes in the medical industry do you foresee in the next 10 years, and how will those changes impact people's lives?
The big change in 10 years will probably be biologics. So the chance that we can do more work with stem cells and possibly prevent the development of arthritis at an earlier stage. So right now, we do offer stem cells. They usually will work very well in patients that have mild arthritis, but eventually we might be able to treat patients with mild, moderate, or even severe arthritis and reverse the effects of the arthritis without having surgery.
What do you like to do in your leisure time, and how do you like living on the Space Coast?
I think everybody knows what I like to do in my spare time. I'm a big golfer. If anyone's ever looking for me, they can usually find me on the golf course. So I grew up in New York, so I was never around water really, but I have gotten used to the Florida lifestyle. I have a boat, and I like to take the family out on the boat. But definitely, if you're looking for me, it's on the links.